Right. So if you have read and understood, considering its surgical pathology station, kindly tell me what are the differential diagnoses that you will consider for this patient?
Uh, my differential diagnosis, uh, considering the scenario,
Yes. Consider shortness of breath, low-grade fever, headache, muscular pain, joints, persistent feeling of tiredness. Yes. What could it be? Which is involving muscles, joints.
endocarditis,
Okay. Endocarditis.
rheumatoid, rheumatic fever,
Rheumatic heart disease. Okay. Or
rheumatic heart
rheumatic fever.
disease,
Yes. And
and can I come back later?
yes, all right. Okay, if we consider infective endocarditis, can you define the term?
It is the inflammation of endocardial surface, including the
Yes,
heart valves,
yes.
caused by certain organisms.
Okay. Can you tell me what type of infective endocarditis are you aware of?
There are three types:
Yes,
infective endocarditis,
yes.
non-bacterial thrombotic endocarditis, and Liebman-Sachs endocarditis.
All right. Okay. Can you tell me how would you confirm your diagnosis? What are the investigations that one can do?
I will have to do a blood culture,
Yes.
and I will do the serological tests like complete blood counts and also echocardiogram. This
Okay.
will help me to diagnose.
Very good. So if you're doing, all right, we'll come back to that one later. But can you please tell me how would you differentiate between native valve endocarditis and prosthetic valve endocarditis?
Uh, uh, First, I will take the history. If there
Yes.
is any history of prosthetic valve
Procedure.
operation,
Yes. Yes.
and then native valve. Actually, there will be damage of native heart valve.
Yes.
There will
By
be some
which
signs and
organism?
symptoms.
Yes.
By usually there are certain organisms like Streptococcus viridans, Staphylococcus aureus,
Yes.
or coagulase negative Staphylococcus, Enterococcus, and Hasek group.
Okay.
Uh,
Right. That is in case of native valve, and for prosthetic valve, which organisms are involved? Is there
for
any?
prosthetic,
Yes. This prosthetic valve endocarditis can either be early within first 60 days or could be late after 60 days, right? So if it is within 60 days, so it will be Staphylococcus aureus or staphylococci. And if it is late, then it could be streptococci, or it could even be present in intravenous drug abuse patient cases. All right, what are the risk factors that can lead to infective endocarditis?
there are risk factors like valvular heart disease,
Yes,
acquired valvular heart disease,
yes,
or congenital structural heart disease,
yes,
like VSD, ASD,
yes,
or PDA, and
yes,
a prosthetic heart valve replacement,
yes,
and any previous history of infective endocarditis,
yes,
any history of hypertrophic obstructive cardiomyopathy,
yes,
any history of devices like the
right.
uh, cardio cardioverter or
Very good.
defibrillator.
Can you please
And
tell me if you don't get to manage your patient on time, what are the complications that you can expect?
there are some cardiac complications and non-cardiac. Cardiac
Very good. Yes,
complications include uh, acute MI, um, uh, arrhythmia, uh, valve, uh,
valvular
valvular
insufficiency. Yes,
insufficiency,
yes,
congestive cardiac failure, pleural effusion. There may be embolism.
yes. And non-cardiac
There may
could
be
be.
non-cardiac complications like stroke, glomerulonephritis, endocarditis associated glomerulonephritis, AKI, or mesenteric abscess or infarct.
What should be the treatment that can be offered to this patient?
Treatments, first medical treatment,
Yes.
like if first of all, IV antibiotic,
Yes.
commonly ceftriaxone with vancomycin, continued for 6 weeks. And if it does not respond to medical treatment, then I will go for valve replacement or
So
blast off
treatment,
heart
you,
transplant.
for treatment, you have to say treatment according to the NHS trust plan or trust protocol. Okay. What are the restrictions that you have to follow while giving, while doing the or while managing the patient with infective endocarditis
What are the restrictions?
that you have to keep in your mind?
So for medical treatment, like
Yes.
IV antibiotic.
Yes. Yes.
Yeah, I will have to keep in mind that IV antibiotic cannot reach uh,
To the valves.
pulse if
Yes.
infected,
Yes.
and there may be organisms may lie within the vegetations,
Yes.
and there may be biofilm production to protect the organism from
What
antibiotics.
blood test can you do or to monitor the progress of the disease?
To monitor the progress of the disease, I will do blood culture.
Yes. And C-reactive
And
protein. Yes. And
uh,
anything else? You can even do arterial blood
echocardiogram.
ABGs. Yes. Echocardiogram
Echocardiogram.
you can do. Patient is suffering from shortness of breath, so maybe spirometry. Right. Okay. Right. Can you also tell me if patient does not respond to the medical treatment, what can you suggest?
I can suggest valvular replacement, valve replacement.
Okay, then you'll suggest a surgical intervention. Okay, even after the surgical intervention, patient's congestive cardiac failure worsens. What would you suggest now?
I will go for supportive treatment.
Okay.
Yes, final option is heart transplant.
Yes, because now patient is going in congestive cardiac failure and it's worsening as well. So when considering the transplant, what should you keep in your mind?
After transplant, there will first of all, HLA matching will be
Yes,
needed.
yes,
and after before in the perioperative period, there will be immunosuppression will be needed.
Yes. Can you
by applying
yes,
chemotherapeutic or steroid.
there are few classes of immunosuppressive drugs. Can you suggest which one would you recommend?
Tacrolimus, tacrolimus, mycophenolate, steroids. These are the three options.
Okay. Yes. All right. Good. Thank you.